Alright, this is part 1 study guide for exam 2 in PN2. Starting on the gas exchange chapters, the different things that cause obstructive sleep apnea are soft palate or tongue, obesity, large uvula, short neck, smoking, enlarged tonsils and adenoids, and then oropharyngeal edema. Pneumonia correlates with possible acidosis when they both present with hypoventilation. Different nursing interventions to prevent acidosis from occurring. The top two are going to be having your patient cough and then using their incentive spirometer. Other nursing interventions are making sure you're checking their O2 stats, having them get up and walk, and then making sure they're staying hydrated. ABG interpretations, remember the normal pH is 7.35 to 7.45. Your normal PCO2 levels are 35 to 45, and then your normal HCO3 levels are 22 to 26. Okay, common symptoms, signs and symptoms of respiratory acidosis are hypoventilation, which then leads to hypoxia, rapid shallow respirations, decreased blood pressure with vasodilation, dyspnea, headache, hyperkalemia, dysrhythmias, drowsiness, dizziness, disorientation, muscle weakness, hyperreflexia. Oftentimes these patients will complain that they can't catch their breath. Opposite of that respiratory acidosis is going to be the respiratory alkalosis. These patients often present with seizures, deep rapid breathing, hyperventilation, tachycardia, decreased or normal blood pressure, hypokalemia, numbness and tingling in the extremities, nausea, vomiting, lightheadedness, lethargy, and confusion. Your patients that present with metabolic issues, if they're experiencing metabolic acidosis, oftentimes you're going to see headache, decreased blood pressure, hyperkalemia, muscle twitching, warm, flushed skin, nausea, vomiting, diarrhea, changes in level of consciousness, confusion, the Kussmaul, respirations. And then opposite of that, if they're experiencing metabolic alkalosis, you're going to see restlessness followed by lethargy, dysrhythmias, tachycardia, hypoventilation, confusion, decreased level of consciousness, dizziness, irritability, nausea, vomiting, diarrhea, tremors, muscle cramps, tingling of fingers and toes, and then hypokalemia. COPD, also known as constructive or chronic obstructive pulmonary disease. It's an inflammatory respiratory disease, progressive and incompletely reversible airflow obstruction. Signs and symptoms of COPD. It can be absent in early phases and you may not know it. The big thing with this is it's a sign of right-sided heart failure. May vary depending on the underlying disease process and if they have anything else going on besides COPD. Hypoxia, barrel chest, cyanosis, clubbing, coughing, sputum production, dyspnea, lung sounds, tripod position, distant heart sounds, fatigued, and anxiety. If you're conducting an asthma assessment on someone, you should be making sure you're checking their ABGs, listening for any audible wheezing and acute increased respiratory rate during an attack, inflammation, coughing, seeing if they're using their accessory muscles to help them breathe and if they have a barrel chest. For the asthma treatment is usually a short-acting bronchodilator or a long-acting bronchodilator or both. The short-acting bronchodilator is used for that acute asthma attack when they can't catch their breath and they can't stop coughing. The long-acting is an everyday use or everyday treatment for someone who lives with asthma. It decreases the need to use reliever drugs and it needs a time to build up an effect. It cannot stop an acute attack. Status asthmaticus is a severe, life-threatening acute episode of airway obstruction that intensifies once it begins and does not often respond to usual therapy. We treat status asthmaticus with IV fluids, potent systemic bronchodilators, steroids, epinephrine, and oxygen are given immediately to reverse this condition. Magnesium sulfate also may be used. Someone who is experiencing status asthmaticus, make sure you prepare for an emergency intubation. Sudden absence of wheezing indicates complete airway obstruction and requires a tracheotomy. I mentioned them before, but the medications for status asthmaticus are potent systemic bronchodilators, steroids, epinephrine, oxygen, and then sometimes magnesium sulfate. Next, signs and symptoms of a pneumothorax, or oftentimes they'll call it like your lung collapse. Different signs and symptoms include a sudden onset, pleuritic chest pain on the affected side, dyspnea, tachypnea, tachycardia, hypotension, respiratory distress, they're air hungry, tracheal deviation, and anxiety. Next is cystic fibrosis, which is an inherited autosomal recessive, which means they received it from both parents, chronic, progressive, and frequently fatal disease of the body's exocrine mucus-producing glands. Signs and symptoms of cystic fibrosis: purulent secretions, productive cough, wheezing, dyspnea, recurrent infections, bronchiectasis, I don't know what that is, infiltrates, scarring, increased chest circumference, apical crackles, steatorrhea, which is fatty stools, and then pancreas infection, also known as type 1 diabetes. Just kind of mentioned these ones. Mentioned above too, the common GI issue with cystic fibrosis is that steatorrhea, which is the fatty stools. Does hyperventilation affect PO2 levels? No, it decreases CO2, but it does not affect PO2. Different signs and symptoms of lung cancer are hoarseness, cough, sputum production, hematopoiesis, coughing up blood, shortness of breath, and then change in endurance. So TB meds, isoniazid, also known as the INH TB medication. The big thing to remember with this one is that it kills the actively growing mycobacteria. Side effects for this medication, or side effects for the INH, is nausea, vomiting, numbness and tingling in the extremities, hepatitis, upset stomach, fever, and rash. The next drug for TB treatment is rifampin, or RIF. With this one, remember this one kills slower growing organisms. And then side effects: upset stomach, heartburn, nausea, menstrual changes, headache. And the big one with this one is it can cause urine, sweat, saliva, and tears to change color. Usually like a yellowish orange or an orangish brownish type color. Different signs and symptoms of tuberculosis. Clinical symptoms may be absent if they are in the latent phase of TB. 2 or more weeks of cough, fever, and weight loss, night sweats, fever, weakness, chills, and hematopoiesis with progressive disease. Alright. Next part of the chapter will be on perfusion. With perfusion, infective endocarditis, which is an infection of the heart's inner lining, also known as the endocardium, or the heart's valves, which causes damage and destroys the heart's endocardium and heart valves. Signs and symptoms of infective endocarditis are vague infection findings, especially early, low blood pressure, malaise, fever, night sweats, fatigued, anorexia, weight loss, cough, back pain, heart murmurs, retinal hemorrhages, Janeway lesions, which are on the feet, and Osler's nodes, which are on the hands, petechiae, headaches, development of heart failure, positive blood cultures, systemic embolization, and confusion. Signs and symptoms of decreased cardiac output, left-sided heart failure, pulmonary congestion, decreased cardiac output, oliguria, fatigue, heaviness in arms or legs, chest discomfort, fast heartbeat, non-productive cough, dyspnea, orthopnea, using extra pillows at night, paroxysmal nocturnal dyspnea, dizziness, acute confusion. Signs and symptoms of heart failure. So that class 1 patient symptoms. So stage 1, there's no limitation of physical activity. Ordinary physical activity does not cause undue fatigue, palpitation, or dyspnea. Stage 2, there's slight limitation of physical activity, comfortable at rest. Ordinary physical activity results in fatigue, palpitation, and shortness of breath. Stage 3, marked limitation of physical activity, comfortable at rest. Less ordinary activity causes fatigue, palpitation, or dyspnea. And then that final stage, stage 4, unable to carry on any physical activity without discomfort, symptoms of heart failure at rest. If any physical activity is undertaken, discomfort increases. Left-sided heart failure. Left ventricular failure starves body of oxygen and nutrients. Left-sided heart failure causes chronic coronary artery blockage, hypertension, the causes of left-sided heart failure, I should say, are chronic coronary artery blockage, hypertension, excessive alcohol use, MI, hypothyroidism, and any infection. This is formally known as your congestive heart failure. It can be acute or chronic, mild to severe. There's 2 subtypes of left-sided heart failure. Systolic heart failure, which is squeezing. The squeezing phase, reduced EF results when the heart cannot contract forcefully enough during systole to eject adequate amounts of blood into circulation, decreased stroke volume, low EF, less than 40%. Vital organs do not need oxygenated blood. Diastolic left-sided heart failure is the filling and resting phase. Left ventricular cannot relax adequately during diastole. Too stiff or to fill. Inadequate relaxation or stiffening prevents the ventricle from filling with sufficient blood to ensure adequate output. And then that has the normal EF. The acronym to remember for the causes of left-sided heart failure is the word failure, which stands for faulty heart valves, arrhythmias, infarction, lineage, uncontrolled hypertension, recreational drug use of like cocaine, and evaders, which is a virus or an infection. Symptoms of left-sided heart failure, the acronym for that is drowning, which stands for dyspnea, rales, orthopnea, which is when you sit up to breathe, weakness, nocturnal paroxysmal dyspnea, increased heart rate, nagging cough with pink frothy sputum, and gaining weight.